Hi, and welcome to Chapter 5 of Melka's Daring to Care. This is Nursing Work, Culture, and Identity. My name is Heather Hayden. We're going to talk about changes in nursing through the decades of the 1960s through the 1980s. Early in the time period, the thought was that nurses do whatever doctors and janitors won't do. That's an actual quote from a nurse. But throughout the period, graduate programs were evolved and the nurse practitioner programs were initiated. And later in the time period, the nurses became politically motivated, and minority nurses found their voice. You're going to see salaries disparity through this time period. Early on, even from the 1940s, in 1945, the nurse's salary was a third of the doctor's salary, but in 1981, it had dropped to less than one-fifth of what a physician's salary was. Though they had salary disparities and multiple changes, nurses continued to gain professional status time period. So early in the time period, you'll see that nursing inherited a lot of the physician's tools and responsibilities, which freed up the doctors for other tasks. But even though the nurses were doing the work, the doctors maintained the responsibility and took the credit for the nurses doing their job. Because nurses were so busy doing what the doctor had previously done, they needed to hand down tasks. And their bed and body tasks, they started delegating. And although they were delegating those responsibilities, they still maintained responsibility for it, just like we do now. And technology took off early in this time period. There were nursing doers and nursing thinkers, and the doers were very technologically inclined, and the thinkers were kind of anti-technology at that time. Older nurses and physicians really resisted technology. But the technology really changed the nurse's role with the doctors and the patients and even each other. It was proven at this time that nursing is different but not really inferior to medicine because nurses were spending so much less time with the bed and body tasks. They really emphasized therapeutic communication in their patient contact. The next section is the doctor-nurse game. This phrase was coined by a psychiatrist, Leonard Stein, who had observed nursing, did a study. The game consisted of how the nurses provided help and recommendations and criticisms to the doctor, but they did so passively so the doctor could say that he thought of it himself. The game really inhibited the nursing's intelligence. It stifled their ideas and reinforced that they were subservient to the doctors, and their professional development was halted because of it. Stein pointed out that the game began in nursing schools because the schools instilled fear into the students by playing games and instilling fear to squelch their independent thinking so that they learned early on not to be independent. And in the early 1970s, 10 nurses and 10 doctors joined together to form the National Joint Practice Commission. The purpose was to bring physicians and nurses together to improve patient care and fight the doctor-nurse game. The NJPC supported equality amongst health professionals, and it was very successful for 9 years, and nurses felt like they were being defended until some nurses on the NJPC actually called to extend the practice of NPs beyond the doctor's control. And the physicians didn't like that. The American Medical Association pulled support of the NJPC and the organization dissolved. But then there was a physician downfall. There was declining respect for physicians in society in general. They had found out that there was fraudulent billing practices. Doctors were doing excessive surgeries that they couldn't justify. There also remained culture and gender biases in medicine. Doctors remained white men through most of this time period. So the all-knowing paternal image was on. Their professional authority also was declining. With the rise of the women's health movement, women became empowered and started to question what the doctor was saying and diagnosing, and they would get second opinions, and they didn't just accept things. Medicare introduced payments by diagnosis-related groups. The doctors maintained the ability to admit patients to the hospital, but they needed to actually prove that they needed to be there if they wanted to get paid, and so they had to fit into these DRGs. The ANA issued Nursing a Social Policy, which called for emphasis in equality and cooperation. It promoted collaboration with other health professionals, but didn't actually specify doctors, which is the first time doctors were really snubbed in the medical community. The next section is specialization. This is a chart showing 8 different specializations, but there's actually over 80 at this time. RN specialized for greater autonomy. The Nurse Training Act funded master degree programs, and the first nurse practitioner program was initiated under the Nurse Training Act. With all this growth, the doctor-nurse lines continued to blur. A lot of nurses criticized specializing because they thought it was a lack of femininity. Diploma schools served as a roadblock for graduate programs because they squelched nurses' independent thinking. But as more diploma schools closed, the BSN programs grew, raising the number of nurses that were able to enter graduate programs. A lot of nurses chose, rather than to get a graduate degree, they chose to join a specialty organization. In 1960, only 5 specialty groups existed, but now in the 90s, more than 33 existed, and now there's over 80. And the specialties started offering certification, which proved their elitism without going to graduate school. Overall, certification specialties and the graduate programs proved that nursing was actually a career for women, not just a stop on the way to motherhood. The nurse practitioner programs. In 1965, a nurse named Loretta Ford and Henry Silver, a doctor, developed the first nurse practitioner program at the University of Colorado. And that program was actually a pediatric program because they were short on pediatricians at that time. The Nurse Training Act provided funding, so multiple schools opened nurse practitioner programs. But at the same time the NP program started, the physician assistance programs also were initiated. The differences were and remain that the nurse practitioner works under her own license, while the physician assistant works under a doctor's license. A nurse practitioner focuses on psychosocial needs and the entire health and wellness of a person, where a PA focuses on pathology and curing illness. In 1970, the American Medical Association called for more than 50,000 nurses to be trained as PAs. And the ANA and NLN objected to the Medical Association and the doctors trying to control nursing once again. When nurse practitioners were on the rise, when they first were initiated, nurses disagreed on the role of the nurse practitioner. Were they specialized nurses, or were they crossing over into medicine? When doctors were in short supply, they cooperated with the nurse practitioners and appreciated them because they freed up doctors to do other things. And it stopped them from having to take call at night in the hospital, and there were multiple benefits to them. But the following decade, when doctors were plenty, they actually fought nurse practitioners. Nurse practitioners were their unwanted competition. Nurse practitioners' big role as nurses sort of gave them autonomy, specialization, professionalism, and feminism all in one package. And that leads us to the last section, which is raising nurses' consciousness. Nurses started to become very politically aware, and this is in the late 70s, really early 80s. Nurses counted on feminists to benefit them And feminists actually fought nurses because nursing was a predominantly female profession, and the feminists saw nurses as being subservient to doctors. So the nurses asked the feminists for help. Feminists actually fought nurses. The nurses took it upon themselves to be politically aware, and they began the Nurses Coalition for Action in Politics, or NCAP. In 1984, nursing actually endorsed its first presidential candidate, and that was Walter Mondale. Even though he didn't win, they did endorse it, and they even came up with a bumper sticker. Their bumper sticker was, "Nurses vote more than 1,000,000. It doesn't sound that exciting, but at least they had one. At this time, union membership grew from less than 5% in the 60s to over 20% of the workforce. And minority nurses really found a voice during this time period. There was an organization called Nurses Now, which is Nurses' National Organization for Women. Fought for a lot of issues for the nursing profession. But the minority nurses, such as men, the black community, and the gay and lesbian community also had a voice. You'll see there was a National Male Nurses Association formed in the 80s, National Black Nurses Association, and for the gay community, Cassandra was an organization, and also the Gay Nurses Alliance was an organization. The gay community really didn't have as much of a voice as the other minorities because at that time they could be fired. It was legal to fire a nurse based on their sexual preference at that time. But ultimately, in conclusion, nursing has made tremendous advances to professionalism in these 3 decades. It continues even till today. This trend, it moves upwards. It seems like daily you see another professional nurse or another nurse performing great feats. And it is up to this generation of nurses that we're in right now to keep this going. So thank you for your time, and I hope you enjoyed this presentation.